I'm going to let our chair introduce herself and start us off, call to order, and then we'll do introductions and get started. Yep, you got your gavel.
I'm calling to order the Cochise County Board of Health meeting for Friday, December the 5th, 2025 at 9 o'clock in Melody Lane in the Department of Health's offices. So my name is Kathleen Gomez. This is my second meeting. I'm the Cochise County Supervisor for District 2. And I just wanted to give a shout out to Alex. He came to Porterville. I had a town hall meeting. We were discussing all the junk, the tires and appliances and the hazards to health. And it was great. We had 60 people turn out, which was a good turnout.
Yeah, it was a good turn.
And this weekend, I'm providing dumpster trashes for both tires and appliances, and probably do it either the following weekend or a lot of I realize the community is elderly. So I do have about 12 guys who said they could do it maybe the first weekend of January because a lot of the elderly can't even bring the tires over. So Jane at Montgomery, our POI, our Public Information Officer, is going to work that out to see if, so we'll have volunteers to eventually help them out. But this weekend is the start of a cleanup Porterville. And I encourage people to know that once we clean it up, we're going to enforce the codes. So they got a good warning, and they were all happy. And Alex did a great job. So explaining all the hazards to your health when you have tires and appliances and rusted stuff and so much junk. So I really appreciate that. So with that, go ahead. Go around the table and introduce yourself.
Suzanne, you want to start?
Sure. Hi, I'm Suzanne Hagel. I am the Prevention Services Manager for the Health Department.
Good morning. My name is Axel Lopez, and I'm the epidemiologist for the Public Health Preparedness Division, and also do some environmental health work.
Thank you.
Hi, I'm Charlotte Taylor. I'm the Community Development Specialist for Northern Cochise Community Hospital.
Welcome.
Good morning. I'm Taryn Beck, and I'm the Administrative Assistant for Barb Lang.
Good morning, everybody. I'm Barb Lang, Public Health Director for Cochise County.
Morning. I'm Emily Harris, the Director of Clinical Services.
Hey, online, Dr. McLaughlin.
My name's Dr. Eric McLaughlin. I serve as County Public Health Medical Director. Thanks, everybody.
Thank you.
I'm
Lonnie?
Lanning Phillip from Sierra Vista.
Susan Warren, Sierra Vista.
Sep, you want to go?
Hello all, Joseph Sepp Spritzma talking to you from Pomerene, Arizona, banks of the San Pedro River. My real full-time job is a College Career Pathways project manager with the Center for the Future of Arizona, and absolutely appreciate all Cochise County Health and Social Services does and has been doing for workforce development in this county, and glad to be here.
Oh, thank you. Jason?
Morning, everybody. I'm Jason Zubart. I'm the Executive Director of Community Health for TMC Rural, which is Benson Hospital and Northern Cochise Community Hospital.
Belle?
Good morning, everyone, and happy Friday. My name is Belda Delsuhag, and I serve as the Cochise County Public Fiduciary. We're a division of the Health Department.
Thank you. Lisa?
Good morning. This is Lisa, TB Coordinator, Public Health Nurse here in the Bisbee office.
Thank you, everybody, and welcome. So I wanted to start out by recognizing our new Board of Health members, Jason Zybart and Charlotte Taylor. Welcome, and thank you for being a part of this important initiative. So I wanted to talk about some of the things that we're going to be doing over the course of 2026. One of the things that's very important to me, and Supervisor Gomez had mentioned it, we have a lot of seniors in our community. And so I really wanted to recognize that. And there is actually a certification for health departments that is designated age-friendly public health department. There is no public health department in the state of Arizona that is age-friendly. So I want to be the first. And so this would be an opportunity for us to recognize stigmatizing language. A lot of people don't use appropriate terms. I was at one of our health clinics, and one of the things that came up is someone said, gosh, there's an old person in the lobby. We don't use the word old person. So it's really about using appropriate language, making sure that we have the appropriate supports, and also recognizing the services that seniors really need and want. So we're going to be taking a course in training, a series of courses actually, to become an age-friendly public health department. We would then get the certification. And as you drive into Cochise County, you see a large fence with a lot of different placards on it for the Rotary, the fire department, and so forth. There would become a placard that says age-friendly county on it. And that's really important to me. So that's one of the initiatives that we're going to focus on at the Department of Health. I am going to talk to the board about making that announcement once we receive the certification that we are an age-friendly public health system. I think this is great for the county. I think it's great for the community to really understand the needs of seniors and recognize that seniors are a priority and they're important. A lot of times when people get older, they talk about being invisible. And we want to make sure that none of our community members are invisible and that we meet their needs. So that's something that we're going to be doing as we move forward this year. I'd like your support in that. Any feedback regarding that initiative?
I know one thing.
Yeah.
I know that my mom and the elderly, when they go in, basically doctors say to them, oh, for your age, well, you know what? You're doing okay. Maybe we'll see you in a year. So I have heard that so much from senior citizens that nobody cares because they're elderly and they're lucky that, oh yeah, well, hopefully we'll see you in a year. So I've heard from them, why even go? Because they're just waiting for me to die and they don't care. And so if we could make that more of a support language where they go in and they feel supported instead of, for your age, what do you expect? And that's literally what they say to them.
Yeah, that's part of it. And I think that's a super important point. A lot of times people talk about seniors being frail, but we know a lot of seniors are bike riders in our community. They do yoga, they have active lives, they're gardening, they're hiking. So it's important for people to be recognized for that. And we're also going to be doing some classes that would really benefit senior health. And we're going to be doing some exercise activities, walking around the track, doing some things out and about in our beautiful community that, is really focused on nature and people feeling included. Because many seniors in our community, they live in outlying remote areas. They need that daily interaction. So we're going to be designing some activities that really help with that. The other initiative, and I know, Kathleen, you're probably going to get excited about this one, is I did talk to the McNeil Co-op, and I'm going to be outreaching all the nursing homes in Cochise County to include healthy fruits and vegetables in their meals. A lot of the nursing homes use prepackaged frozen stuff, and we want people to be healthy and eat well as getting that income into our co-op and keeping that income in our community. So McNeil Co-op's very excited about it. I'm going to be reaching out to our senior homes and getting some healthy food on their plates. So I think that's going to be one of our initiatives as well. Keep it local, keep our seniors healthy, and make sure they're getting the nutrients that they need, that they're not getting from those frozen meals. So I'm very excited about this. I hope you all are excited as well. I think it's going to be a nice initiative. It is going to take a little bit of time, but it's something that's easily accomplished when we all work together.
I think it's a great idea, being one of those seniors there with my gray hair, saying that you got to be tough to be old. And so I'm glad to see that this initiative is going down a path. And I hope you'll kind of keep us in the loop as you move through the year to see. So good job, Barb.
Thanks, Lonnie. And, we'll be the first in the state, which I think is exciting too. It's getting rural on the map, putting out that good news for Cochise County and making sure seniors understand this is a safe place. So
I'd like to add to that.
Yeah.
Like in Douglas, it's all based around the youth, right?
Yep.
So I'm pushing for a senior citizen community center, or to be part of the community center that they're establishing. But McNeil is a real problem with the elderly because their also poverty level is really bad. So I'm going to try to see if I can help John Breyer, whatever his name is, and getting some kind of building that's a community center for them where they can come to meet, because he's basically the therapist. And I've seen people come in there who definitely have some mental health issues.
Yes.
And they're out in the, I mean, in the opt-out committee. I don't even know how they're living without sewer and all that stuff. So that is something that maybe we can work together as we strive to make McNeil, because it's mostly elderly.
Absolutely. And the Haven is a senior center in Douglas.
Right.
And so they'll be one of the places that I'm going to be talking to you about those healthy fruits and vegetables from the co-op. Yep.
And, you know, maybe we should talk to Jose, the mayor, because I'm trying to, he's 38, he's very focused on the youth, and I'm trying to steer him to, you know, senior citizens. So, you know, anything you need in support from Douglas, let me know.
Oh, that sounds great.
Have a meeting with him.
Yeah, and I think you don't have to choose one or the other, right? We can support youth while still supporting seniors. And I think, you know, we can even do some things together. One of the great things about seniors is they love youth. And so having programs where they get together to spend time together is something we can do. It keeps youth involved. It keeps seniors feeling included and really tackles that social isolation issue. So very good. Seth
does have a question.
I'm tossing items into the chat. I absolutely love and support the whole idea that you're sharing and the approach. I did put a link in there to the Foundation for Social Connection, which might be a helpful resource. I know you guys are way more experts in these kind of things in social connection and public health than I am, but I happen to be a fellow for the Foundation for Social Connection this year.
I love
I'm still learning about it, but it may be a resource that could be helpful. They have some great data and kind of strategic plans and toolkits. So I put that in the chat, but I 100% appreciate and support this approach that you guys are undertaking with the health department.
That sounds great. We do have to do a strategic plan for the age-friendly initiative, so we're going to be getting together and working on that. We'll definitely share it with the board to get feedback. And then once everything is tied up and zipped up nicely and we get our certification, I'll be talking to the board about making that proclamation that Cochise County is an age-friendly community. So we'll go from there. I'm glad you all are in favor of it. It's something that I'm very excited about, and I think it'll be a really nice thing for us to do, and we'll be the first in the state, which I think is really exciting. I love that. So
that's great. Cochise County leads the way.
That's right. Thank you. That sounds like a good bumper sticker, Lonnie, or a t-shirt.
Okay.
I love it. Okay, so the next thing is the Justice Care Collective. So the board had given us permission to move forward, and we had an activity here in Bisbee where folks that were homeless or indigent, really isolative, were able to get non-criminal warrants waived. And there were a number of people that showed up, and we had a lot of nonprofit treatment groups come and support those folks and enroll them in treatment or give them information so when they're ready they could get into treatment. We had sober living homes, we had mental health residentials, we had peer support programs, we had crisis mobile programs. It was a very productive day. No one was arrested and people left feeling good that they could start over. There was a little bit of intrepidation because I think folks felt, is it a trap? Is this for real? So we anticipate when we do the next event in Sierra Vista, that'll be much better attended. We're going to do that sometime in January or February. I'm going to be meeting with folks next week. Then after Sierra Vista, we're going to do this activity in Douglas and then Benson. So it's been a nice way to wrap around our community. And the idea is we don't want people in jail that are homeless or have mental illness. We really want the real criminals in jail. So this is an opportunity to really be tough on crime and put people who need to be there, but people who are struggling with issues of social determination, really getting that support and treatment that they need. So it was very successful. The judges were great. Law enforcement was great. County attorney was great. And of course, all the providers that showed up for the people. So we're going to be doing this again, like I said, Sierra Vista, January, February, then Douglas in the spring, and then we'll move on to Benson. So the community has been in a lot of support because they want the right folks to get the help. So it's been a nice opportunity. And this is just another thing, more good news about Cochise County, putting out there that, we care about our community. And we had all ages and backgrounds show up. We had some elderly folks show up. We offered vaccines for flu. A lot of people got their flu shots. We also offered HIV, STD testing. A lot of people asked for testing. And so it was a nice opportunity. And we had Cochise Harm Reduction handing out camping equipment for our homeless folks. So it went really well. Police said it really gave them an opportunity, and the sheriff's office, to show the other side, that they care. They want people with mental health and substance abuse to get help. They don't want them crowding their jails. They want to make room for people who actually need to be there. And so I think it was a good day for everybody, where we really wrapped around our most vulnerable populations. Okay. So infectious disease and situational awareness. I'm going to hand it off to our epidemiologist, Axel.
All right. Thank you, Barb, and good morning again, everyone. I do have an update for 2 or actually 3 topics that are important right now. The first one being measles. I know there's a high alert going throughout the state. And I do want to mention that here in Cochise County, we're never isolated from everyone else. We're traveling. We're getting our family coming over from other parts of the state or even other countries sometimes. So I wanted to start with measles.
Can you guys see the slides?
Yes.
Okay. And with the chicken health, I also wanted to give an update for everyone so we're on the same page on what the county is doing and how we're getting prepared just in case we get measles hit our county. So we currently have an outbreak in the state of Arizona, and it's ongoing. And here I wanted to provide a little timeline of how the distribution of those cases looks. Back in early June, Navajo County had 4 cases that were associated to travels to Chihuahua. And then that kind of sparked the whole preparedness discussion throughout the state. So all the other counties were ready just in case there was a positive. And sure thing, early August, this is when Mojave County started having a problem with an outbreak along the Utah-Arizona border. So far, there have been 155 cases in Arizona for this year, with 151 of them corresponding to Mojave County. It is also an important thing to mention that most of these cases are unvaccinated or undervaccinated minors, highlighting the importance of giving our youth the shots that are in the vaccination recommendation schedule. Mojave County also has a lower than average vaccination rate at 88.4% for both doses for MMR.
So you want to talk about what the percentage is that we want to see?
We want to see at least a 95%
Yes.
To cover what's called herd immunity. And here in Cochise County, we actually have a little bit higher than what's desired at 96.4%, which, yay, go
That's good for us.
Okay, so we also have a little breakdown on the right side here with the case counts for the past years. We had a few scares, Coconino County, Maricopa County, but nothing super big compared to this year, which we're having about a 30-fold increase from the past few years. Okay. So the hospitalization rate for the cases in Arizona this year is about 2.5%, and thankfully no deaths have been reported. Okay, so repetition is key. Repetition is going to help us remember some of these important details. And also the visuals. I think it does help put a mental image on what we're looking for in case any of these patients show up to our hospitals or clinics with an abnormal rash. So the incubation period for measles, once you're exposed, it's from 7 to 21 days before the onset of the symptoms. And so there's this incubation period when we're not infectious yet. We're still building that viral load. And then the second stage, that's the infectious period. That's we can pass it on to one another if we're vaccinated or unprotected. So the prodrome is also known as the early stage. And it's about 12 days from the day you got exposed. That's when the symptoms are going to start kicking in. Maybe your conjunctivitis or runny nose, which is going to make it really difficult to differentiate from other seasonal conditions like the flu or COVID or any other condition that's going around.
And where do you initially first see the rash? Most of the time.
It usually starts on your face and your forehead and starts moving downwards. So that's another key sign to look for in your patients.
Thank you.
And so the prodrome lasts for about 4 days before the rash takes in, but you're already infectious before the rash develops. So there's a critical time frame to diagnose it and institute public health actions to prevent any further spread in the community. And so the rash starts about 4 days after the onset of the symptoms. Here in Cochise County, we have had a few scares, at least 3 I can think of right now, from different facilities reporting, hey, we saw a patient, we suspect it might be measles, and then the whole conversation starts between the facility, the patients, and the health department, trying to identify some of those risk factors. And just so you know, here in Cochise County, we have a whole team dedicated towards investigating and discussing the possibilities of certain infectious diseases. That includes our medical director, leadership, nursing, and other staff members. So in all 3 of these scenarios, early communication has been key into the sharing of information. That way we can look up the shot records, we can establish communication with the patient and ask about their travel, maybe even exposures to someone they know. And when it comes to the facility, they can start isolating the patient and taking their corresponding precautions. In some instances, they have also been ordering the patient to stay at home until those lab results come back. So all of these 3 scenarios have been negatives. Wasn't measles, it was a rash due to another condition. Which condition was it? We don't know, but we're happy it wasn't measles. So
yes, we were.
They all come with lessons learned. We can always improve on our preparedness plans. It's always good to put them into action every once in a while because it's never perfect. There's always room for improvement. This is a recap from the previous slide, just putting it in a sequence. Once we're exposed, we incubate the virus. Some of these symptoms start kicking in. But I do want to highlight the Hopelik spots, which are the ones that develop inside your cheeks, like little white spots, white bluish spots. That's also another indicator that we as the providers to look for. If they're present, then that might escalate the response. And also the rash, it's called a maculopapular rash because they're tiny. They're flat, but sometimes they'll have bumps. And again, from forehead down to your body. So some basics that it's always good to remind everyone is the must-knows. The symptoms, the rash, along with the fever, cough, runny nose, and conjunctivitis, and spots inside your cheeks. Here we have another picture towards the bottom of what it might look like. And we have some documents prepared to share with our partners for testing, which is a swab along with a urine sample because that's where it can be detected most accurately. There's other methods like a blood draw that might not be as specific or reliable or preferred. So nasopharyngeal swab with urine sample, that's the gold standard. And then following the lab's instructions towards preparing the specimen, holding it, and transporting it. But if any facility suspects measles, please report it within 24 hours to the health department and we'll start working on it together. Well, how is it transmitted and what should we do? It's transmitted through the air, both in aerosols, which are the very tiny particles when we sneeze that travel further away. And then there's the droplets, which are heavier and tend to fall faster. Those aerosols can remain suspended in the air for about 2 hours, depending on factors like humidity, heat, ventilation, and the droplets tend to fall within seconds. So there's that potential. Even if we're in a large room, if somebody sneezes and they have measles, then you can be 10 meters apart and still get exposed to it. So instituting the airborne precautions from the onset of symptoms is very important to avoid any of that sneezing, coughing, and transmission happening at the facility, like the ER, for example. It is also recommended for the patients to call ahead of time. That way the facility is prepared once they show up and they may be taken to the isolation room or the airborne infection isolation room. I do want to give a shout out to all of our infection prevention staff at the hospitals. They're great and I love working with them. They're really a key piece towards the investigations. So kudos to all of you. And recommendations. Figuring out what their MMR status is. Do they have 1 shot, 2 shots, or no shots at all? That's going to help determine and funnel down the possibilities of it being measles. And asking about any recent travels, especially to locations that there's known documented measles transmission happening. Running the lab work sooner is going to help rule it out faster, and that's going to take a less of a toll on the patient. And we should also consider other diseases that can result in a rash. Again, diagnosing something only by the way it looks, there's some margin of error there. So running the lab work is going to help determine whether it is or it's not. And again, reporting to the health department within 24 hours and establishing that line of communication with the facility is going to help run things smoother. Okay, I want to make a pause there. Is there any questions about measles before we go on to the foodborne illness updates? All right. I wanted to bring this topic to the attention because right now it's the holiday season. We are sharing food, we're going out as a family, and this is usually when some of those outbreaks tend to pick up. So we're going to be looking specifically at Salmonella and Campylobacter infections. We do have some case counts coming up ahead, but just so you know, our case counts have been similar to what we've seen in the past few years. No drastic changes, which is good. But it's important to talk about because both of these are hitting our 55 and over population the most. For the last 3 years, Campylobacter infections in the 55 and older group account for 59%, while Salmonella accounts for 62% of all those infections. And we're going to discuss some of the complications that those might bring about. But some of the common foods upon our investigations that have been identified are undercooked eggs, including those with backyard poultry, chicken that's been undercooked, beef products, seafood, and any leftovers that have not been kept properly at the right temperatures, which is maybe a habit that we all have, just leaving food out and eating next day.
Grazing.
You're probably going to go over this, but I just have a question.
Yeah.
As far as the 55 plus, are you going to explain a little bit more of why it's more prevalent in that age group?
Yeah.
Okay.
Yeah.
That was a great question.
Yeah. So for camping infections, we have had about, so far, 92. And those numbers for 2023 and 2024 are the whole year. So we're still missing a month for this year. I anticipate it's going to be about 95, 96. And for Salmonella, we've had 30, 24, and then 29 cases this year, which is about what we would expect looking at our historical data. But not only the infection itself, it's what's important, but the cost to the patient's insurance. So per episode, this is all data from the USDA. They collect data and they analyze it. Campylobacter infections tend to be about $13K, including visits, treatment, and wages lost. While Salmonella tends to be a little bit pricier at almost $17,000. But some of the complications also, besides having a GI distress, could lead to dehydration. And we have actually found this upon investigation with some of our patients. They become dehydrated. They need some electrolyte treatment like sodium, magnesium. Because once we start losing those electrolytes, we start feeling weak and dizzy, which in turn may lead to falls and other injuries. You know, it just starts snowballing and getting worse and worse and worse. So it's something that's preventable, and it has the potential to have really bad outcomes. So once an elderly person, 55 and over, falls, there's that risk of breaking hips or other injury like traumatic injury to the head. So overall, it just leads to a loss of quality of life, maybe in the short term or even in the long term.
And so just as a caveat, one of the things our environmental health team does is they inspect restaurants. And so these things don't always just happen in your home, right? Or visiting a home. These also happen in restaurants. That's why it's so important that we have an environmental health team that goes in the kitchen, makes sure foods are being refrigerated at the proper temperature, things are being cooked at the proper temperature, there's no cross-contamination, using the same knife that you cut meat to cut vegetables, making sure things are being not left out, there's hand washing. So all of these things really we focus on a daily basis to ensure the health and safety of our community. And I know sometimes restaurants get a little ruffled when we come out because they feel like, you know, government intervention, but we're really there to see them be successful and for the community to be safe.
And that was prices from 2 years ago, so right now.
Yeah.
Yeah.
So how to prevent foodborne illness transmission at home or even at restaurants, like Barb said. It ties into the health behaviors of people, you know, washing your hands. That's something that can be done within 30 seconds, and it has the potential to cut down on the chances of getting a foodborne illness or even transmitting it to somebody else. If you're sick, the diarrhea, vomit, just don't cook for others. Keep them safe. They're your loved ones. Cooking the foods to the right temperature and holding them at the right temperature is also super important, because if they're not, some of those bacteria that are naturally in the food items, they're just going to start reproducing again. And also properly cooling the foods and holding them at the right holding temperature. These are all little steps that we can take at home to reduce our chances of getting sick through food and getting our loved ones sick. And going back to the question that you had about why is it more prevalent in the elderly? Maybe some of those health behaviors start kicking in, like maybe not washing hands or maybe not putting the food away at the right moment. And there's one more I want to talk about, which is norovirus. It's reportable, but it's so widespread that there's no investigation behind it because it's just everywhere. It's also called the winter virus because it transmits mostly throughout the winter. And it's really nasty diarrhea, vomit for a few days, super transmissible to others. So again, washing hands and not cooking for others while sick is very important. And then the last item I want to hit on, our respiratory reports are going to start coming out today. Keep an eye out for those. Our case counts for COVID, RSV, and flu have been lower than expected, which is good. And these reports are going to start coming out every other week. So if there's any questions on that, you can always get a hold of us at epidemiology@cochise.az.gov and open it up for discussion or questions if anyone has anything.
Any questions or comments on what's been shared? And I'll send out the respiratory report as soon as that comes out today. Dr. McLaughlin?
No questions. Just really wanted to commend Axel. That was awesome. Very detailed, wonderful, good transitions between your topics. Awesome job. Great job. Thank you, sir, for the education.
And I think they're really very helpful. What I do is if I can take it, we have an internet here in Winter Haven, and about 600 residents are on it. So when you send something that I can take and reproduce and send it back out, we've notified 600 people. So I would say keep it up and think about as you're formulating it, that it's for reproduction also.
That's good to know. And our nursing team has made some really great one-page, two-page at-a-glance informationals on measles and so forth. So I can send that to the group as well to give to patients, community members. It's a nice, short informational sheet.
No, it's really appreciated here at Winter Haven. So keep it up.
Great. Sounds good. Thank you. Any other comments or questions?
I have a question that's probably, I don't know if it's not on the agenda, but I noticed your email about the screwworm.
Yes.
So can you tell me a little bit more? Because that's exciting news.
Yeah, so they're looking at a potential vaccine that would assist in eradicating that. They're working very hard because they understand the importance of cattle as a commodity. So that's in the works.
And when you say they, who is?
It was the CDC.
And the FDA together.
Okay, thank you.
Yeah, the latest identification in Mexico is about 120 miles south of the border, Texas, Nuevo León.
Okay.
So that's going to keep cattle from coming in until next year once they reevaluate the situation. But what we're doing locally, we're going to participate in a tabletop exercise put together by Pima County next week.
Okay.
Towards identification and what to do once the emergency of the screwworm, if it ever hits our county, what we're going to do and how we're going to respond to it.
That's going to be great news. Okay.
Can I just share?
Yeah.
Back in the day, I don't even remember exactly when this was, but my grandmother was part of the team down in Douglas that helped with the original eradication of the screw.
Wow.
Here in the United States.
That's amazing.
And she's talked about it quite a bit. So when this came back in the news, she's like, no.
Show grandma, simmer down. Well, we're working on it. And to that point, Axel talked about, we do a lot of tabletop exercises in public health to address the potential of national disasters, not only with the screwworm, but with any kind of, planes crashing, railways coming off the tracks, any kind of biohazard. So we want to make sure on an ongoing basis that we're prepared. And so we have a team that Axel is a part of, our public health emergency preparedness group. We work in concert with emergency management here for the county. So if anything happens, we're not going to panic. We have the skills and technology and strategies to address things in a calculated way to keep the community safe and to manage and contain the site. So that's something that we participated actually in, and I was there. I know Taryn was there last week with local law enforcement, Border Patrol, different leaders from the military. So it was a full day exercise. So we do that on a regular basis. And that's something a lot of people don't recognize that really is an important crux of public health, that we are prepared if Cochise County were ever to experience a large disaster. You know, we looked at Starliner landing here in Wilcox. That's still an ongoing dialogue. You know, tens and thousands of people would come out. We need to identify roadways. We work in concert with public health. If something were to happen, if there was a leak, a chemical leak. So we're constantly revising and looking at our emergency plans in order to manage things if something were to go awry. So with that, I wanted to talk about the Board of Health on the move. I think one of the things with the Board of Health is we're a really well-known secret. And so I'm about transparency and getting people involved. So one of the things that I would like to do is transition these Board of Health meetings. We can do them in Douglas, we can do them in Benson, we can do them in Sierra Vista, and of course we can do them here in Bisbee. So what I want to do is invite the community. I think it's really important. One of the things that I think about government is people feel there's not enough transparency, and that's super important to me. I know that's very important to Kathleen, that we reach out to the community and we let them know what we're doing, why we're doing it, and we answer questions. So I'm going to start scheduling these meetings to go to different areas. I know Benson Hospital has offered their meeting room to us, invite the community to pipe in on Zoom. And a lot of people say, gosh, the community might throw things out there that is scary or we don't know what they're going to ask. That's okay. We have the skills and knowledge to answer those questions. We want to be transparent. We want people to know what we're doing. And we want them to know that we're focused on their wellness. This is not anything political. We're an apolitical office in public health. This is about really getting the information out to the people and allowing them to make informed choices. So if I could get some feedback on that and see what people think about the Board of Health on the Move initiative.
I think it's a good idea. I think what it is you build it and they will come.
Yeah.
Because right now, you know, we're a 4-meeting-a-year organization, so it's kind of, you lose the continuity here. But we found that in many instances, when I'm with a legacy foundation, people will show up if you publicize it. And I think it's great. I know that the reaction I get when I provide some information from the health department has always been positive. Like the last one, on the shots for COVID shots and so forth. A lot of people will just email me and say, gee, that's great. Thank you. And that's all they say. So I think it's a great idea. And there are certainly in Sierra Vista, different places you could do that. The Legacy Foundation is going to be opening a brand new event center at the end of this year or the first next year. It's almost done. It'd be a great place. So I think it's a good idea.
Great, thank you. For me, it's really about establishing trust. You know, healthcare is not government care, it's community care. It's social care plus clinical care is public health. And I want people to understand that public health is a lot more than vaccines. It's education, it's connection, it's, you know, transportation. It's really that umbrella, that safety net. Sep, did you have a question or comment?
I put it in the chat, but I just want to make sure it's crystal clear. I support this idea 100%.
All right.
Especially in Cochise County, I think that the realization that the government is us and we are the government, when the Board of Health and the Cochise County Health and Social Services is in the community, people realize, oh, that's my neighbor. that's my that's my my daughter's best friend. That's my the person I see at Safeway in line at 6 p.m. So
That's right.
helping people make that connection, I cannot say how much I support the idea. I think it's fantastic, and that it moving around from community to community is just a great idea.
Perfect. And it doesn't have to be, we can do I would love to do some remote areas like Bowie and Portal. I think, sometimes those folks feel forgotten, and I think it's really important. And we have a board that is very community focused. And I think going out to the folks, building that trust, talking about the partnership, and that we'll hear from them is really important. Belle, you had a thought?
I also think it's a great idea because not only communicating it to the community so you can have more opinions, more feedback, and of course including everyone, but taking the meeting to different locations because of their transportation challenges. If you didn't do that, even if you advertised, people, seniors, and even working class would have a hard time going. So I think it's a great way of getting new ideas and getting people more involved, and really for them understanding that there's so much more to public health, and a lot of it is prevention. So while some people may not be in agreement with vaccinations or medications, different things that are after the fact, then I think a lot of people will be in support of all the preventive programs that we have.
I think you make some really good points. And, there's so much information out there right now that's very confusing to folks. It's coming at them from all angles. So I think just really clarifying things and sharing risks and benefits so that people can make the best decisions for them and their families is very important. So I'm glad to hear people are excited about that. I think having students, high school, HOSA, people who are interested in healthcare, I love that. It might extend our meetings just a tad, but I think it's important for the community to know that healthcare is community, right? It's community care. So I'm glad that people are excited about the initiatives that we reviewed. I'm going to turn it over.
One comment?
Yeah.
I like to have the one in Douglas at the Cochise County building.
Sure.
It's very central.
Yep.
And it can, take a huge amount if we need it. And I also think, Axel, I called you Alex, sorry about that.
No worries.
I think it was really important. Purville was shocked to have had Axel there. So the next town hall meetings, I think it's really imperative, which I'm going to do more, is to have Axel there to talk, because even the Board of Supervisors doesn't understand everything you guys do. And now I would just like you to have bullet points like, inspection of dining restaurants, and the screwworm. They don't understand how you guys are involved with that. And so you need to market yourself even within the government, because we don't know what each other does. And so I think it's really imperative that the next time you come, and I'll say to speak on my direction, that I wanted you to bulletproof all the many, many, many things you guys do, just like also with the whole warrant thing. They don't understand that's part of what you do. You do so much.
Yes.
So I think it's really imperative that you promote yourself and market yourself within the government.
No, I can't agree more. I am going to be coming to the board quarterly to talk about public health as a whole and all the different departments that we have, prevention, promotion, clinical services, epidemiology, public health emergency, our environmental health folks, our public fiduciary. So we have a very large array of services. So
and you need to remind them every quarter.
Yes, I'll do that. Thank you for being our champion. I appreciate it.
And Barb, I just wanted to say
Yeah.
thank you for mentioning San Simon and Portal, and please also consider Wilcox. I know
Absolutely.
we service
Yeah.
Bowie and San Simon and Sunsites and Pierce.
Sunsites is a pretty good community center.
Yeah.
That you get out.
No, that's a great point. I think getting out to the rural, remote areas is extremely important to me. I think a lot of times, Belle talked about transportation, but it's also just, there is a large amount and focus on the larger communities. And so we want people to feel included, not isolated. We want to have those conversations. And I appreciate that reminder. Yeah. All right. I'm going to turn it over to clinical services, my nursing director, Emily Harris.
Yeah, we currently have no reports to make as it relates to facility reporting. No incidents or safety concerns.
So that's a good thing. We haven't had any accidents or anything that would require reporting at any of our 5 clinics. So that's always a good thing. So now we're going to move on to member concerns. Does anybody have anything that they want to talk about, anything they want to bring up, anything relating to public health in general that's a concern or something you want to champion or discuss?
Yeah, let me make just a comment, Barb.
Sure.
I really enjoy the board meetings, even though they're 4 times a year. What happens is that we're losing continuity, or we don't have continuity, I guess I should say. And I was just wondering if there's some way that in the off months where we aren't meeting, we could get a one-page newsletter or something, bring the board into focus here, because otherwise we probably won't talk to each other or look at each other until March, unless we do something in between. And unless you have continuity in an organization, you have a pretty tough time getting a high motivated organization. So that's just a suggestion and comment.
No, I think that's a really good idea. You know, I would defer to my chair if people feel like we need to meet every other month rather than every quarter. I don't know what your calendar looks like.
Well,
Yeah.
Counted,
Yeah.
but I think it's going to be really important, especially with a new port of commercial entry. And, you know, my efforts, you know, and I'll talk about that in a minute, on what the situation is in Douglas and wanting a hospital. And as we grow, I think there's going to be just concerns. And I think we don't market like ourselves well enough. And so maybe meeting every other month is a good way of just keeping abreast and knowing what we're doing, so that the different social media pages and different, you know, outreaches that everyone has, they can send it out. Because quarterly is a little bit long. So, I mean, Fridays are usually good for me at this time. So it depends on, you know, the rest of the board, what they feel, but I would be for that.
Okay. Do I have a motion to meet every other month?
Also move.
Okay, second.
I'll second that.
Okay, great. So moving forward, we'll go ahead and meet every other month. And then in between, I can send out a newsletter, Lonnie, that just updates anything that is happening that's emergent within the context before we meet for the following month. And I think this will be nice for the community too. We'll joggle around and I'll give folks notice. I like the idea about the community center. I like the idea Charlotte articulated about Wilcox, San Simone, some of the other communities that we can hit. And I think just really, as Kathleen said, rebrand, market ourselves, let people know that we're there for them as a community, talk about some of the initiatives, the friendly aging, public health department, what we're doing with workforce development, what we're doing with the trash cleanup, the environmental visits, the vaccines, the chronic disease focus. So I think there's a lot of things that we could be talking about as a community, as a group. So I like it. I like where we're going in 2026. I think it's going to be a nice year for public health.
Very good. Cochise County leads the way.
That's right. Thank you, Lonnie.
And I must say it helps me at learning about what everything you do. So
Very good.
It's a bonus for me. So at this point, I'd like to just talk a little bit about what I'm seeing happening in, especially in Douglas, as far as ambulatory and being able to get out of Douglas to get the emergency health needs that you need. And it's nothing like a personal experience, right? So on November 3rd, my father was picked up by the fire department in Douglas. Whenever you call 911 in Douglas, the fire department comes. The only place they take you is to the ER in Douglas. They don't take you to Bisbee. They don't take you anywhere else. So my dad gets taken at 3 o'clock in the morning, and I think we need to look into, and having worked at the hospital at CMAC here in Douglas, we had emergency ER doctors. I think most of the time it's not an ER doctor that is looking at the people who come in. So they started to give my father a lot of fluids. What ended up, it stressed him. He got a heart attack. His kidneys started to fail, and he started to get filled up in the lungs with fluid. From 3 o'clock, we tried to get him out. There was no ambulance that could come. The two pilots called in sick. So I don't know if it's Lifetime or LifeNet that does the life flight. So here's another key. In Douglas, people pay an extra $5 on their water bill to have airlift capabilities. My father also had a subscription to PHI from Sierra Vista, which I didn't know about. So as we're trying to get him out, there's no ambulance service. I got called at 5 o'clock. I was in Tucson. I heard of what his problems were. Having had worked at CMAC, my very good friend is now the CEO. She's a nurse, so I don't know if they call him CEO, but she does Sahuarita in Northwest in Sahuarita. She worked for St. Mary's, so she said, listen, I'll get all the doctors you need, take him to St. Mary's. So I'm trying to get him out, and I find out that the helicopters are down. So I'm trying to find out why. I called the mayor of Douglas. He calls, and what happened was the two pilots called in sick. And there was not going to be any staff until the nighttime. So everyone's telling me, get him to Bisbee. My dad is 6'4". He's now on intravenous. We can't move him. I can't just go pick him up and take him to Bisbee. And the mayor calls, and when I find out that, he says, listen, and this I don't like. He said, this gentleman is the ex-mayor of Douglas. I'm the mayor of Douglas, and his daughter is the county supervisor. That was probably about 10 o'clock. By 11:30 or 12, he's finally picked up from Sierra Vista by the PH1. I'm at the hospital by this time in Sierra Vista, and the doctors tell me this is catastrophic. There's nothing we can do. Your father has been too long waiting in the ER to get air backed out. So we said, well, let's try something. We tried to get an arterial line in to read his blood pressure, and it was just impossible. We tried 4 times. He was in such pain. The other problem is he's suffocating because he's full of liquid in his lungs, so he's for about 7.5 hours. So he was in a lot of pain. We finally decided we can't do anything, and within an hour he was gone. This just doesn't happen to my dad. That same day, my girlfriend's mother-in-law, at 2 o'clock, she goes to the ER. She has to be in ICU. She has to wait to 8:30 that night, and she's intubated. And so they have to take her intubated to Sierra Vista, and then from Sierra Vista to Tucson. It's amazing that she survived. 2 weeks before that, it happened to Eddie Munoz, 8.5 hours at the ER, couldn't get out, he dies. And I'm hearing from people, in fact, Ana Urquijo's daughter had a gallbladder that was going to burst. She had to take her from Douglas to Bisbee, and then Arizona ambulance, I think, had a problem coming, so she just took her to Tucson. So this is a serious issue. I've asked Barbara to look into what the wait time at ER is for people who are seriously ill and need to be air-vacced or taken out by ambulance, and it's very strange. Sometimes Arizona ambulance comes, sometimes it doesn't. And I understand that I'm entering into a huge rabbit hole when it comes to the way that ambulances are, I guess, have their contracts within several districts. So one of the other things that kind of ties in is with the city annexing Sunnyside. They're losing money. So what I am looking at doing, and I've just had a meeting with Elfrida Fire District and Sunnyside Fire District, is for them to merge and to cover a lot of the no man's land in between the two. And then we had Frank Lara. I don't know if you know, Frank is really good he worked for Douglas with EMT services. So maybe that would be a possibility of luring another ambulance to deal with Sunnyside and Elfrida once they merge. That would help Douglas. But I think this is something that I've just been hearing constantly. That ER is not a hospital. And I say this, and people say, well, you got to get over it. But at CMAC, we had a hospital, air helicopter there. We had ambulance. We had one at the airport in Douglas. When one left, another one came. I don't know what we did that was so different. I don't know if it was having a hospital that made that possible. But we have a community in Douglas that is elderly. We have about 5 or 6 people that are over 100 years old. It's only growing older. We do have a good amount of youth, but that community is aging. And this is a serious problem, and it's going to impact, because I've heard several people say, like Robin, who brings her mother here, I don't know if I'm coming back to Douglas because I don't know if my mother at 88 will be able to get out. And I'm hearing this now continuously with people who are saying, maybe it's time to move to Tucson because I don't want my parent to die at the ER in Douglas. The other concern is we have to get on top or find why or do a good way of telling people why Pima Heart has left Douglas. There's a lot of rumors that they were fighting with Copper Queen or Copper Queen did something. Then I heard they're falling apart themselves. So the community in Douglas is really upset, because they go to Pima Heart. And because they're aging, that's where they go, a lot of the elderly for, like my mother, blood pressure, how her heart's doing, blah, blah, blah. So that happened, and there's a lot of talk about why did Pima leave, and, a lot of rumors are going around. So that's one thing I think we could do a better job in trying when that happens to find out what it is and tell people what the truth is, so they don't start gossiping and then it becomes, how it happens. So, of course, my effort has always been, I think a town of 16,000 that could only grow, and with the community of Agua Prieta needs a hospital. I've got several different, and it's not just a hospital. I wanted to have a mental health campus because we don't have anything like that in the Cochise County. And it also, under statute, not only is the county supervisors able to create a county hospital, but we could have a county farm. So I like that attached as maybe a way for rehab. We could do some food sustainability also near the area. I see my prayers thing. I got land. I've got 3 hospitals that are interested in running it. And now I'm getting together a consortium of people to have the cost of building it. I was told, as you know, that nobody builds hospitals anymore and there's no economic development to it. Yet I went to that Cochise County health workforce, and heard the 3 presidents of CEOs of Bisbee, Sierra Vista, and Benson say for every dollar you spend in a hospital, you get $280 back in economic development. So I'm very transparent. I don't hold anything back. Sometimes it hurts me because people will then know and then they'll try to stop me. But I only feel if I'm transparent in what my goals are, the truth will get out and people will understand why I'm doing it. But this is really a huge concern of what's happening at the ER in Douglas. With no ambulance service, and I don't know how. I asked the city to give me the amount of what Douglas pays on that water bill. What is the amount? $10,000, $20,000? But I think that the helicopter company should have a backup of staff. There should never be where both pilots call out sick and, oh, by the way, I'm not going to have anyone until midnight or when the night shift starts. That to me is unacceptable. So I've asked Barbara to look into that for me, and anything else anybody could help with finding out what's going on. And I think once that we start to talk about it, it's going to be something that's going to become an animal unto itself, but I think it has to be discussed. So I'd love to know what anybody else thinks of that.
Yeah, so we have a couple things. We've got really 3, and then Dr. McLaughlin, I was thinking about you because I know that Dr. McLaughlin actually worked at the Douglas Hospital.
Oh, and
so I'll let him talk to that. But before I do that, we've got 3 issues. We've got the Pima Heart issue, we've got transportation, and then possible gaps in care. So let's start with Pima Heart first. Is anybody aware of what's going on with Pima Heart? Jason?
Sure, I can talk about that a little bit. Pima Heart recently lost a number of providers. Trying to get the exact number, but I think 12 cardiologists will have left between July and December. And that has caused them to not only pull back from Douglas, but also Wilcox and Stafford. They are, at least currently, as far as I know, and they still come to Benson, and I talked with them yesterday, they're planning to rebuild and rehire people, but it's simply a staffing issue. They have no capacity to continue going to these other places right now. And as a matter of fact, they they aren't going to cover as much of the inpatient aspects of Tucson anymore as well. It was, it was a big deal to have that many folks decide that they were going to seek employment elsewhere. As far as I can tell, the organization is still doing well. They were here yesterday doing stress tests and echocardiograms and saw 60 patients. So it's just going to take them some time to bring back up the staffing levels to where they probably would need to be. So that's sort of.
So Jason, do you think that they will return to Douglas when staffing levels are up, or when they're in Benson? Can you inquire, or Wilcox, can you inquire what their plans are with Douglas and let me know?
So
Okay.
we just officially got notification yesterday. And I
Okay.
assume Douglas did too, that they were not going to come back to Douglas or back to Wilcox anytime soon.
Okay.
Because they asked to end their lease, which isn't a big deal because we have a specialty clinic. You can just pick it up whenever you need to. But yeah, I will ask, and it's way out ahead of it, but we're talking about what would a different rural cardiology strategy look like? Is there something else we could do? Like, this kind of took us all by surprise. So, it's going to take a little bit of time for me to really wrap my hands around it and see what we can come up with. But there's maybe some other options out there as well. So.
Okay.
Well, that's great news because, again, there's so many elderly that go to Pima Heart and can't go anywhere else. Even going to service is a problem. So that would be something I think that we need to really, which is great about meeting every other month, to talk about a cardiology strategy for for Cochise County.
Okay, that sounds good. Now, as far as transportation, and then we'll get to the hospital part, I don't know network sufficiency, if the city of Douglas, if Mayor Grijalva is thinking about doing like an RFP for an ambulance service, they may want to look at doing that. I can certainly call the Department of Health, the state that manages emergency transportation, and see what their recommendations or what kind of support they can give. But the city may need to look at putting something out there to say, hey, we don't have enough network sufficiency and we're looking for additional, an ambulance company to come in and provide these services.
Well, that would be a good thing for us then to meet with Jose.
Yeah, absolutely.
So-
Happy to have that conversation. And I can call the state and see what support they can give.
Yes, because I don't understand why, and I don't know if there was a contract issue between the fire department and Arizona Ambulance. I remember that there was some issue 2 years ago, and then this is a bad issue because nobody talks about it, and so there's not a conversation for people to understand what happened. And the city council just didn't do anything either. So now we got a situation where nobody can get out of Douglas. So,
well, and the hard part too is the ambulances don't always dispatch timely because there may not be bed availability. And so that's another hiccup or thing that we're navigating.
and and if that is the issue, then people need to know.
Yeah.
Hey, if you're
Yes.
or you're sick,
Yeah, absolutely.
go to Bisbee or
Yeah,
Douglas.
right.
Get the thing and go as soon as you can.
Yeah, copper them out.
Yeah, so they need to know what the limitations of their health is, and unfortunately, that's going to be a hit for economic development. So, but I'd rather people know. If you're sick or you think, you're going to have an issue with your gallbladder or whatever, get out of town, unfortunately. Or go to the ER, get your vitals, but then don't wait for an ambulance or don't wait for the helicopter. Have someone be there waiting for you to take you to Tucson.
So I guess I need to figure out, is it a network sufficiency issue? Do we not have enough ambulances? Or is it the ambulances we have are not doing due diligence?
I think it's going to be big, and I'm going to announce it that I told him I want to do an investigation on the whole thing and let it be open and transparent and let people know. It may hurt us, but I'd rather it hurt us economically than have more people die waiting to get out.
I think getting the facts never hurts.
Exactly.
Okay, so Dr. McLaughlin, you want to talk about hospital, maybe gaps in care? Give me your thoughts.
Yeah. I'll begin by saying that I'm very proud that I got a chance to serve as an emergency medicine physician at CMAC. That was a tiny little rural critical access hospital out of the way, and it did amazing services. It truly punched above its weight class. It I was clinical and relatively young in my career at that time, but we would see patients in the emergency department. We would do rounds in the morning. The doctors would cover the inpatient and the emergency department. And you would work long shifts. The medicine was challenging. The patients were sick. I'm sure they've probably only gotten sicker. And that hospital and those people did amazing things there. It was such a wonderful team. The provision of rural healthcare. This is a common story that I hear, and the provision of healthcare in rural areas is very complex and it's under attack. Hospitals are closing. CMAC closed. We were gutted and heartbroken by that. I was actually part of a team that tried to resurrect it when it was purchased by People's Choice briefly, and they had all the classic problems of rural inpatient and critical access care: staff, funding, access, and that downstream trickle effect is what we see with getting patients to a definitive level of medical services. So yeah, it's good to remember the care that was provided at that facility, and I'm a little sad. Just I hadn't thought of that in a while.
Well,
And
Dr. McLaughlin,
yes,
it's
ma'am.
interesting because I was the public relation, POI, all that when it was closing. And I will say this, and everyone knows it. It was due to political reasons.
Yeah.
You know, the CEO from Bisbee, Dixon, had told me at the Arizona Hospital Association meeting he was going to close Douglas for the statistics that Douglas provides in getting grants. And I fought really hard, and people did not understand what was happening. But I fought very hard, and in fact, Annie Benson had asked me to come back when the People's Choice or when the doctors had bought it. And I actually was told by the powers that be that if I showed up, I was going to be arrested. So it was a very political thing. And I a lot of people will say, oh, well, the Border Patrol owed us $10 million. But we were amazing under Mike Carter, what we were able to do at that hospital. And when, one of the board members hired their son-in-law, he basically came in, I feel, to shut that hospital down. So there was it was an internal political thing that, people just didn't get up off their butts to see what was going on to stop it. So that's why I'm very passionate about it, because when I was there, I saw what we did, and I saw how we made money, and I still think and feel, I'll die trying to get another hospital back, and I think I'm pretty close. But it was amazing what happened in that hospital and what it did. And we got to the point under Mike Carter, we were even thinking of doing cosmetic surgery. That's when you're doing well, when you can start doing that kind. We had all kinds of clinics coming down. We had doctors who love to fly down. I don't buy the line that there isn't that same kind of people. I hear constantly from the nurses who used to work at CMAC that they love to come back. So I believe I have the will. I will die trying, and I think it's doable. So I'm really appreciative to hear you talk about that, because it was a great place to be. And it was a great place for the community, and we need that back.
It was, and I'm still friends with a large number of the staff on social media from there, and they've kind of scattered to the winds, unfortunately. But I will be a champion with you, ma'am. That
Thank you.
Resurrecting something like that would be amazing and needed.
Yes, thank you so much.
The hassles of transporting patients, moving them around, Miss Lang and I can dialogue offline, but there are some wonderful resources out there. As medical director, I participate in the Southern Arizona EMS calls that are all the, and I'm going to mispronounce it, SAEMS, SAEMS. But it's just the emergency medical services directors and the aeromedical and the rotary and the fixed wing ground crews that all come together and talk about what's working, what's not. Let me see how I can facilitate some more involvement with that and this specific story. Because there's some good minds on those calls and those meetings that may be of resource.
That would be great.
That would be a suggestion, and we can coordinate that, Ms. Lang, offline, because those are quarterly and they're very beneficial. With respect to, moving patients around again, the idea that there are agreements in place to move patients, people count on these things. I don't know, not understanding the details of all this, but, if there are agreements to cover shifts and those shifts aren't covered, that's a concern, because this is what happens. We have this in a hospital or a clinic. If we don't have the staff to be open, well, that's a problem with the service provider. Failure is not an option in healthcare. And I'm disappointed to hear that was the what appeared to be a root cause of this lack of transportation capability. But the ability to house inpatients, overnight, that's a complex one. And this is where those critical access hospitals really shine. These are specific designations and that are given to facilities less than 25 beds to house patients overnight. Critical access hospitals are the root of what gives good medical services in rural areas. Literally, it's in their name. They're in the critical access areas and they provide these. There is mountains of literature about the funding required to obtain these designations, to access federal grants and subsidies to provide this. But I heard the term earlier from Mr. Lanny about if you build it, they will come. Then at that point, you have a hub and you have the room and the space for these specialists to come and visit. And you have places to keep machinery and equipment and diagnostics. And much like a community center, that is the root that grows out into healthcare, into the community. And it all begins with that critical access hospital designation. And I would love to wade into this. This would be a wonderful, truly breathtaking project that I think the community would need and benefit from. I'm in 100%.
Great. I'm really glad. I'm close to getting the land, so that's step one. So thank you so much, Dr. Laughlin.
Of course, yes, ma'am.
I look forward to talking to you.
Please consider me a resource on this, ma'am. However you need me, and you know how to get in touch with me, but I would love to dialogue about this, ma'am.
Okay, thank you.
So as follow-ups, Jason, if you could give us information on Pima Heart. Dr. McLaughlin, I'll work with you on any hospital dialogue as well as the ambulance. Is it a network sufficiency issue? Is it an operational concern? Kind of figure out where the opportunities for improvement lie. We're going to start meeting every other month. Yes, Charlotte.
I'm just wondering how
Yeah.
formal this is because we had the motion in the second, but we didn't vote.
You're right.
And
We
I'm
didn't
not-
vote. Yep.
Sorry, too many years.
Nope, you're exactly right. It must be close to Christmas because I neglected to figure that out. Thank you, Charlotte. So if we could have a vote, I in favor of meeting every month.
Aye.
Great. Lonnie? Nay, opposed? Okay, the ayes have it. Thank you. We will formally voted.
I
and we will
voted
meet
aye,
every
but I
other
was
month.
muted.
Oh, okay. Well, we appreciate that. Thank you for your support, Lonnie.
Also, we're going to have a meeting with the mayor of
Yep.
Douglas, okay?
We'll meet with Mayor Grijalva to dialogue. Dr. McLaughlin?
Yeah, I forgot in all the reminiscence about CMAC. For cardiology solutions, even if you don't have a clinician in person, telemedicine should just be called medicine nowadays. And these are very viable options that can be established, whereby if you can't get the cardiologist down to the site, you can still review labs and pertinent information and deliver services in a telemedicine type of program. I don't know what Pima Heart's capacity is for that, but I know they're utilized in other areas this way, and that may be a solution for a stopgap, if you will.
No, that sounds good. Thank you for that. Does anybody have anything else before we conclude? All right, we've talked about a lot of good stuff today. We talked about 2026 and the year ahead and all the great plans and initiatives. So I just appreciate everybody's time, and I will put it over to our chair to conclude the meeting.
Okay, the meeting is adjourned as 10:20 on December 5th, 2025.